Hello. Hello, everyone. Hi, Sasha. I think we're just waiting for Denene to join. Thanks, everybody, for making this coffee chat. Hi.
Hello. How are you?
I am great. I'm great. I'm super
Excellent.
excited, Denene, to have this coffee chat together with like all of our friends out there. This is a
I'm excited as well. It's been too long. We've had a chance to connect with folks. I'm excited.
Yeah, so
Yeah,
this is a webinar, which means we can't see all of your beautiful faces out there, but you can send us questions. We really want to make this a discussion.
absolutely.
Yeah,
Yeah,
so
cool. All right. So should we get at it?
it's 1 o'clock on a Thursday afternoon in New York
It's
City, rainy,
it's
hot New York City.
it's time for a coffee break. Listen, first of all, I'm just thrilled that everyone took a half an hour of their time to spend time with Nora and I. We really are excited about it. Um, well, first of all, I'm Denene Rodney. I'm the founder of Zebra Strategies. Many of you know me. And for over 20 years, we have been partnering with our clients as well as the communities to deliver research with under-resourced communities. And it's our mission, and we are excited about that. Um, Today, we are going to talk about the patient gap. But I want to talk a little bit before I want to introduce my co-presenter, actually, Nora. Nora Herting and I have worked together for a few years. And I want to talk a little bit about our origin story. We met at a conference, the Diversity for Alliance conference. And I believe that Nora was complimenting me on something I had on. And then I was complimenting her on something that she had on. And we had this long, conversation about shopping. But in the end of the day, we ended up also partnering together on projects professionally. So it's been a great partnership professionally and personally. And I'm thrilled that we get to present today. So Nora, take it over.
You all are missing out on whatever shoes Deneen is wearing because I can tell you, I remember it was Deneen's shoes, and all of you who know Zebra Strategies already know what amazing branding they have. And Deneen is so passionate about what she does that she's like on brand all the time. So there were these zebra slides that you had on. And then I only remember what I was wearing because then later you told me you bought the matching jacket to the pants I was wearing. So
That's right. I remember
yeah,
that. Yeah.
we were
Yeah.
we were twinning. But then, as time has gone on, I just learned so much about your perspectives and the work that you do, Deneen. And eventually we got to work together. And that's really what we're going to be talking about today. So those of you who don't know me or ImageThink, as we put the power of visuals behind patient and health for the last 16 years, our team does this in a wide range of capacities that might look like live visual note taking. We worked with a lot of great people who are on this webinar. So thanks all for being on.
We're getting the link unless Denise sends it. Yeah.
Um,
I'm
but
sorry.
but also, in this capacity, it's really about work that we love doing around illustrating unmet needs in patient groups, caregiver groups, around health equity journeys. So really, this is a passion that Deneen and I really share, and we have some work we're really proud to feature.
Definitely. Thanks, Nora. We do have a shared mission, and I think the shared mission is better outcomes for under-resourced communities. And I think that better connections create better outcomes, right? That's important. And so I want to quote Dr. Joel Belville, and if you're not familiar with him, he's amazing. I adore him. And he says, if we solve problems for the marginalized, the middle also benefits. And I just think that is so true. So as we're moving through all this, it might seem that we're talking about under-resourced communities, but everyone benefits. And I want to quote also Dr. Lena Green from the Hope Center. And the Hope Center is a center that provides free mental health services for under-resourced communities. And Dr. Green says that we move away from traditional medical jargon and language, right? We don't refer to patients as patients. We refer to them as innovators because they are courageous, right? And we want to have affirming language, welcoming language, right? So, listen, language is important, but other things are important as well. So today we're going to talk about some of the things that we have in our toolbox, right? For Zebra, some of the things that we have in our toolbox is racial concordance, cultural humility, overstanding or over anticipating, right? But today we want to talk about something that Nora has brought to us. It's a new tool for us, but it's very important to us, and we think it's very effective. Nora?
Yeah, great. And we love that you think about what we do, the power of visual thinking as a tool for connecting and understanding patients and patients' unique perspectives. And so I have Sasha Brito on my team joining today that you're going to see her capturing live visually our conversation as a way to a little bit to demonstrate what that is like for an audience, but also for you to have, for those of you on the call and those of you I know have colleagues that wanted to attend, that you can share the discussion that we have. So Sasha, you can pin Sasha if you want to see the visuals as they take shape, and we'll also send it off to all of you afterwards who registered. So Denene, it is July, warm and steamy and wet in New York, and sometimes people like to take it easy, right? So why now? Why are we hosting this coffee chat in the middle of the summer?
I know, why now, why not? I think we have to identify the problem more now than ever. I think that hidden gaps equal hidden harms. And those harms create barriers, right? I also think that when we think about what's happening externally, I think there's even more of an opportunity for these hidden harms to be very impactful. So that's why now. When we think about patient gaps, obviously access to care, trust, digital tools, these are all things that are gaps. But I also feel that they show up more, and we know that in under-resourced communities. So we've got to figure out different kind of ways to connect in research, in marketing, and in communications. So that's kind of really why now. And when there's there's silence, we can't solve for silence. And we'll talk a little bit more about when we talk about silence, what we mean. Nora?
Oh, that's so powerful. I love that. Dropping a little gem there. You can't solve for silence. Yeah, absolutely. And when you think about what's happening, like these under-resourced groups are potentially, in even bigger risk of becoming further under-resourced. And I remember, like, from the first time we met, you had such passion around what you do, but you shared something with me about shame, which I had never really thought about in relation to the work that we do. And I'm just wondering, you want to share a little bit about that now?
I think shame is a big issue. I think it creates an opportunity for under-resourced folks to not express what's really happening. Specifically specifically with patients. I'm not going to say patients, specifically with innovators, right? Shame makes innovators uncomfortable expressing their real experiences. So again, we can't solve for silence, right? So if shame is involved, how do we solve for that? How do we express that, right? Their needs are invisible, and if the needs aren't visible, if they're not expressing those needs, how do we solve for them? And I'm thinking specifically, Nora, about some of the work that you and I did around the doulas that are doing work in under-resourced communities, and some of the unique experiences and issues that those doulas have. And a lot of it, I don't know how I could express verbally some of the shame that we heard and some of the distrust that we heard. But you were able to do that. And I want you to kind of talk about exactly how you were able to do that. I guess they say, a picture paints 1,000 words. And I kind of feel what you did for us with the doulas really helped to bring that home.
Yeah, when you shared that with me, I was really touched and proud that you felt that we pictured shame in that. And as you said, like, you can't solve for silence. But what in the work that we do in a session, there's that presence of listening and visualizing and validating the speaker. So, even if they didn't speak specifically, like no one said that there's shame in our communities in this conversation between these two doulas working in Harlem, right? But they did talk around these stories that got captured. And then the act of validating that experience by picturing it can be really powerful. So that also builds trust. I have had a caregiver come up to me after caregiver session and advisory board, and these were caregivers of patients who have really debilitating conditions, say, I want to hug you right now. Can I give you a hug? And I was like, why would you want to give me a hug? And said, because I just feel like you listened and you made visible something that, I felt like I was suffering alone in. And so, thinking back about the doulas and just reflecting their experience and hopefully building that trust, right? Because trust and distrust was a big topic that they talked about within their communities and within the pregnant population in their communities. And at that time, I was also just thinking about my own experience because I had given birth to my son like not long before that. And what was, what I could relate to and what I really couldn't relate to because, their communities were having such different experiences. And even on like an intellectual level, knowing that maternal health for women of color in New York State, we have terrible stats around that, has been an issue to the point where the state has now piloted having doulas in these communities. It was really powerful to hear that firsthand, right? Even though I knew the facts around it. And that's also part of the power of what we do, right? Is we can picture that, we can visualize that experience and pull the stories out that the patients are sharing in a way that's validating for them, but also resonates and is accessible for other people when they go back to review the work and review the conversations. And one thing I remember about that session that we did, Denene, is your conversation was so natural with them. And how are you when you talk about trust and you talk about shame and you're going in a professional capacity, right? How do you go about kind of bridging some of these gaps, and specifically also just thinking about shame?
It's difficult, but there are three things I think I want everyone to remember, right? One is that shame silences the truth, right? And for as long as I've been doing this work, and I don't know if you have a different experience, Nora, I've never had anyone raise their hand and say, I don't, I have a reading level of a third grader, or I'm functionally illiterate, or I don't really understand what I'm reading. So if you are ashamed and you're silent, we can't solve for that, right? So that's one thing. And the other thing is that I also, literacy blocks understanding. And the other thing is that, again, those medical terminologies and other, difficult terminologies, again, shame makes people say, you know what, I'm just going to check out. I'm not going to engage and say that I can't read, I don't understand, I'm going to check out, right? And so for myself in our practice, we're always trying to over anticipate to create an opportunity where if you have a third grade reading level, then we're going to make sure that you understand. And if you happen to have a 12th grade reading level, then obviously you'll understand, right? So we want to solve, like Dr. Belville says, we want to solve for the marginalized, and then the center will benefit. And that's kind of how we have really positioned our POV with this. And I think it's important for us all to remember that. Nora, I think you should talk a little bit about how that relates to what you do.
Yeah, absolutely. I also, though, you had one tip that I just want to share with everybody, because when I asked you, we were talking about this, like, well, how do you accommodate for that in sessions you're conducting with patients and communities? And you say, well, we have people, correct me if I'm wrong, but you have people kind of read over the materials together.
Yes.
Too, so
yes.
that
Yes. Yeah.
that gives maybe somebody who is not reading at the same level some coverage, yes.
Yeah.
But it's
I mean, I tell
yeah.
people help each other out. Why don't you guys help each other out? Let's not assume that everyone can read. I don't say that, but I think we have to just kind of make it okay to talk about what might be shameful to you, right? We've got to, how can we make this okay? We make it okay by saying, you know what, this information might be difficult to understand. Come together and try and work it together. Yeah.
Yeah. Well, listen, it's not even just someone who might be like traditionally like have a low literacy level. I think that complex information is complex for everybody. And, maybe it's just the world we're living in where we have so much information, we're bombarded by it, whoever we are. But I think about work that we do in a different capacity at ImageThink, and senior executives come to ImageThink to create compelling, clear visual presentations for their CEOs. And then the CEOs come to us and say, oh, I have a board meeting and my board only, can only look at 3 slides, and I need to tell the story in a really compelling way. And I'm not going to be able to do it, in a bunch of PowerPoint slides. Or we had an organization that was working with disadvantaged populations, but she came to us not about simplifying their message for the patients they were serving, but simplifying the message because she was pitching a state senator, a US senator, for funding. And she's like, he doesn't understand what we do and we need to make it really simple. So it's not, I think it's complexity is out there everywhere. Overwhelm is out there everywhere. And, we help make things digestible in plain language for all sorts of people. Even, the most, senior people that you can imagine running global companies can still benefit from storytelling and reduce complexity. So, and the reason I think that we have such a long track record in healthcare is it's at a nexus of where there's technical, medical, complex information on a technical level. Then there's the systems that patients have to navigate, the medical system, the payer system, the provider system. And then there's the emotional level, right? The emotional level about like your own well-being, and sometimes getting really, being really disadvantaged of where you are in your health, that can be really overwhelming. And I know there's lots of, studies around that. So I think about just in terms of literacy, like a project that we did for the AFHHO, which is a refugee-led organization for the Swahili-speaking community in the US, like the Northwest. And they were trying to figure out a way to have these sessions during COVID around men's health issues because, generally men do not seek medical advice as much as women. In this population, they felt like that was even more of an issue. And they wanted to talk about prostate screenings. They wanted to talk about, COVID protocols. And so, the goal was to improve health outcomes for this population. But by having us there, it helped create, it broke down barriers, right? It broke down cultural barriers. It broke down language barriers. And it also, in a way, created a safer space and created kind of a level of removal that visuals can do. Like you can see Sasha's doing it now, that I think gave people some safety, as well as just helping clarify that information.
Okay. Well, I mean, I think that's important, but I do want to talk a little bit around some quick statistics around literacy, right? Just, quickly, 9 in 10 adults struggle with health literacy, right? 23% of Black and 34% of Hispanic adults have low literacy rates, right? And we think about limited English proficiency, then the numbers even shoot up higher, right? We've got like 44% of folks that have limited English proficiency, right? Having issues with health literacy as well, right? So, I mean, with this type of data, it's obvious that people are falling between the cracks, and we've got to figure out different ways to communicate with folks, right? And I do feel it's a hidden barrier because there's an assumption that everyone reads, right? So if you read, you should understand, you should be able to read things. And that assumptions really makes people pull back from being honest about what they can understand. So I do think, Nora, I agree with you, but I also think the problem is a little bit larger than we tend to acknowledge. But I want to hop into a little bit more around why visuals are such a powerful tool.
Yeah, and I think the best way to tell that, because I'm looking at like our coffee cup, which is almost empty, here we are at 120, is to talk about the work that we did together around
Yes, definitely.
because we're so proud of that work, and I think it illustrates, no pun intended, a lot of these topics that we're talking about and these barriers that we've been discussing.
Right.
So introduce
Cool.
kind of, you know,
Yeah, so quickly, I mean, we are running a little behind, but we did a project with Nora, and it was really around the um, women of color and their experiences with chronic illnesses as well as terminal illnesses, and how their experience was different. And I mean, it had a, this 90-page deck that was, brilliant. But what I really wanted to do was figure out a way visually, right, to show the humanity, to show the isolation, to show the humiliation that some of these women are experiencing. We had one woman who was going through chemotherapy, and when she went to get her her appointment, the nurse almost gave her another Black patient's chemo regimen, and how she felt was um, humiliated. She felt dismissed. And I wanted us to kind of express some of those things that we found in that 90-page deck visually. And so we came to Nora, and Nora was wonderful and really did some excellent work in kind of visualizing that. And so, Nora, I don't know how you do it. Like, I just know that I'm like,
yeah.
say we
Well,
have this,
listen,
we got
you're
that.
giving me a lot of credit. Thank you, Sasha, for pulling this up. It is really, there's a whole team behind this, and Sasha leads this sort of work at ImageThink. So, a lot of it is data is really talking to the owners of that about how they talk about it, what resonates for them, where's the story, and really pulling the story out, right? And for us, there's sort of two. We decided to personify this in a chronological way, right? Because that's the experience that a patient has, and it is so important. There's so many places where these gaps can show up. We also wanted to make a character kind of the healthcare provider, so that there's sort of two characters here, and to do it in a way that honored both, so that if you're a patient that contributed to the study, you see yourself and you say, I feel heard, and I picture myself here, I can relate to this. But also the healthcare provider sees their role in it in a way that's not going to raise defenses, but that can help connect for them the impact of all these touch points in a really humanizing way. And then we did that, also around thinking about the colors that were used, like making them uncomfortable. There's this gray, right, when you're going through a life-changing event like breast cancer was your example, what that must feel like emotionally, and then kind of the discord with the yellow and the red. So kind of picking up those cues. And then also really thinking about how is this information going to resonate with the viewer. So honoring the patients and their experiences, but also thinking about how this was going to be disseminated and who we wanted to also be able to relate to it, which is the healthcare providers and which are the decision makers that are in a place to possibly some of these elements and address some of these gaps. Because if they can't relate to it, if they can't see the impact quickly, then no change is going to be made, right, for patients and closing these gaps. So kind of the end user and how that's going to resonate quickly and making it emotional is really a driving force for us and Sasha and our team in working on this project. And we're really, really proud of being able to depict this, because it is there is such a big gap and there's so much work to be done around it.
That's so interesting because I didn't realize the gray and the red and the yellow. So I've learned something new today. Yeah, interesting, interesting.
Yeah, yeah.
I think that, we've got like 5 minutes left, so we want to kind of do some wrapping up. But I mean, listen, I think it's important to remember that, this particular framework is a part of a toolbox of a larger things that we have to think about when we're trying to reach under-resourced communities, but also to keep in the back of our mind that um, we have to find new and innovative ways to reach out to folks that are not expressing um, what they're going through, what they're feeling, or what some of their uh, insecurities are, whether that insecurity be literacy, whether that insecurity be a health condition, You have people that are embarrassed to talk about certain health conditions, right? And so they're not saying, I'm going to the bathroom many times at night, or they're not saying I have these issues, right? So it's really around constantly for me, and I know for Nora as well, trying to figure out how do we make that connection? How do we address the shame? So I think that's something that we want you all to leave you all with. Nora?
Yeah, absolutely. And so thinking about this from a visual standpoint, is the visuals are a way to articulate what's not directly being said, right? And to create a space that builds trust by validating what these patients are saying that in a concrete way. And we can listen differently in those live settings with visuals. And then it helps align on action because by creating these visuals, then it's also not just for the experience of those in the room, but it's something that's compelling, that's quick, that can help align on action as you go out of these sessions, rather than just simply, an AI note taker. We're really pulling the stories and the humanizing elements out of this. And even within healthcare teams, that can be really powerful for just connecting them with the purpose of the patient. I've heard that from clients over and over again.
Definitely. So I know we have 3 minutes, and it's interesting when when we were putting this together, we did think it was a lot of information, and we were right. But we have 3 minutes, and I wanted to see if there are any questions that our attendees have that we can answer. Any questions?
You do. You can put them in the chat.
Put the questions in the chat. And also, I mean, I know I'm always available as a resource as well as Nora. So you can always send a quick email if you want. If you have questions, if there's something that we mentioned that you want us to follow up on, we're happy to do that as well.
Oh, I see one here, which is how do you measure the impact of this kind of work, and what kinds of outcomes should people look for? I think that that's a great question.
Do you want to start on that one, Nora, and I can jump in?
Sure. Yeah. From our standpoint, it's we always measure the impact when clients come back in this type of work and say, oh, we actually want to use this in a poster presentation that we've been approved to present. Or this was so valuable that we want to work with you to polish what we heard because we want to share this across advocacy groups. We did one line of work where then it got translated into 12 languages, and it was all about caregiver tips for caring for children with severe epilepsy. So, for us, like when clients come back and say we're repurposing this for bigger audiences, we know that it really has resonated. What about you, Denene?
I mean, I think that I agree with you, Nora, but I also feel like when we were doing the work with the doulas, I mean, they were just so appreciative. And for me, the entire experience, not one of the doulas said, you didn't get that right, or I would do it differently. They were just so affirming and excited to have what they feel and deal with reflected accurately. So I think that's probably an indication that you've succeeded. So yeah, I think also too, just quickly stepping back to shame, uh, sometimes you don't know, right? Sometimes you've captured it beautifully, and the shame is still there, but at least the person can say, wow, I'm not the only person that is uncomfortable having a conversation with my partner about IBD, right? So they might not say anything, but they've their thoughts, their feelings, their shame has been expressed. So I would say that's to be considered as well.
Yeah, you always bring such a humanizing element to it. I really appreciate that, Zanine. And thinking about, again, measuring impact and a takeaway. So Sasha, thank you for visualizing this part of the conversation. Oh, beautiful. We will be, in the short time, we covered a lot. I know there was a lot there. As you can tell, Janine and I are very passionate about this. So if you're interested in learning more about these particular stories or other stories, we would love to connect. We'll also be following up and sending Sasha's visual recap to all of you. And we hope that you share that with your teams. We know that there's a lot of people on this call that are really passionate about closing these patient gaps and just bringing health equity and understanding and overstanding, as Denene Rodney says, to patients out there. So Thank you so much for joining us for this half hour. And
Yes. And if you, and Nora and I, of course, are always open to other other toolbox options that you all might know around that you're using as well to connect with these types of audiences, right? Yeah.
absolutely.
Yes. So we just want everyone to continue viewing the world in a softer lens, and we look forward to continue the work. Take care.
Take care. Thank
Bye-bye.
you.